But moving on, the cancer burden continues to grow globally, exerting physical, emotional and financial strain on individuals, families, communities and health systems. A team of cancer survivors from Uwezo Cancer Support Group have embarked on creating awareness on the risk of cancer and the hope of battling the disease. The initiative, according to an official member, aims at encouraging and supporting cancer survivors. Pauline Nasimiyu reports.
Under the auspices of Texas Cancer Center, the group of cancer survivors got an opportunity to freely interact with experts and share experiences as they battle the cancer disease. An official member of Uwezo Cancer Support Group, Esther Nzoli, said that for most people, a positive cancer diagnosis increases social isolation, which often leads to depression since most of them don't have the right information on cancer.
It was not easy for me, even when results came out. It was cancer, cervical cancer, stage 4. And you know, in the mind, when you are told you have cancer, definitely it's like you have lost everything. So to me, it was like life is no more.
A cancer survivor, Dorothy Mulei, noted that battling cancer is not easy and it requires a lot of support from the family and those around you.
Immediately we came here, Texas Cancer Center, saw Dr. Nongesa, admitted for 2 weeks and then I was managed. But then she referred me to a hematologist, a doctor that deals with cancer, blood. And then he told me, and then partially they treat here in Kenya, but for fully treated, I should choose either South Africa or India. And so that would cost about 2.5 million. So the first shock was the cancer, and secondly, the money.
An oncologist at Texas Cancer Center, Dr. Catherine Nyongesa, said that cancer is difficult to detect since it has symptoms like other diseases, so patients tend to be diagnosed for other diseases only to get a cancer diagnosis when the disease has progressed.
One of the challenges we face is delayed diagnosis, so they come when the cancer is a bit advanced, some of them. Another challenge is the financial. They don't have an HIF card or they don't have money to pay for their treatment. Another challenge is just navigating through this difficult system, like, from the counties to go to Nairobi, where you can get actual diagnosis and treatment. So that just the complexity also brings a challenge to them. Another one is the family support. Some don't have good family support, and then the stigma. Some people assume that when you have cancer, it is, and which is clearly not, because we've seen it from the cancer survivors.
She acknowledges the support of the government in helping reduce cancer cases in the country.
The government has really done a lot in the past. I would say in the last decade, we have many cancer centers that have come up to just assist with patients. I can just name a few, like the Kenyatta University Teaching and Referral Hospital, Moi Teaching Referral Hospital. Today we are launching the Nakuru PGH Hospital for just cancer care. Soon we'll be launching Garissa. So there's a lot of development in that aspect.
They spoke at the Texas Cancer Center while celebrating the National Cancer Survivors Day that brought together cancer survivors from different parts of Kenya. According to research, majority of cancer patients are admitted to cancer health facilities when the cancer stage is advanced. This is because most are misdiagnosed. Reporting from Texas Cancer Center for Lunchtime News, I'm Pauline Nasimiyu.